Well, coronavirus and flu are different viruses. They behave differently, even though, of course, they both cause respiratory disease. I think and hope this pandemic is going to be nowhere on the scale of the Spanish flu of 1918. That pandemic killed at least 50 million people, we think, perhaps twice that. The equivalent numbers today would be between 220 and 440 million people. So, we're looking at a little over 200,000 deaths from the coronavirus here at the moment. We're not over it, of course, and we don't know what's going to happen next. But I really don't think that we're going to be looking at a pandemic on that scale.
And it was a different time. World War I was nearing its end. Did the virus spread a lot faster because of troop movement, for example, or events at the time that we're not faced with now?
That is one possibility. It's very difficult to prove, of course, because history doesn't give you a kind of control condition to compare against. But lots of people have tried to explain why that pandemic was so bad. If you think about the 5 flu pandemics we've had since the 1890s, none of the others killed more than 4 million people. That one killed 50 million people. So it really was extraordinary. And one of the theories is that it was because the world was at war, because there was extraordinary circumstances prevailing in the world, that it was so bad.
And there still are some similarities, though, not only with the 1918 pandemic, but the other ones that you also mentioned. Similarities in terms of the way people reacted to the crisis. The lockdown measures that are in place, are they more or less the same? The message is just stay at home?
It's a really good point. I mean, there are definitely historical parallels that you can draw. And one of them, I think, is really striking, which is that in this period before we have a vaccine, and there is the distinct possibility that the pandemic will be over before the vaccine is ready, then the only real way we have of preventing people from falling sick is, the so-called social distancing measures, everything that goes into lockdown, isolation, quarantine, masks, and all the rest of it. And those are not new measures. Those are pretty ancient for the most part, and they're exactly what they were using in 1918, and they were having the same debates as us over them.
Well, in terms of leadership, what worked back then and what didn't, if we're talking about limiting the spread of the virus and keeping citizens calm?
I think that, then as now, it's pretty clear that the best leaders are the ones who are transparent, who communicate regularly and simply and often, who take advice from the best experts of the day. There is a little bit of research to show that it mainly comes from the States, that those cities that put in place public health measures, social distancing measures early in the pandemic and kept them in place for long enough, that is, past the peak, flattened the curve and so on, those had the lowest mortality rates and also recovered most quickly economically. So that might be a really interesting thing to take into account today.
And would you say that those that were complacent too soon suffered from the second wave of infections that hit, which really boosted the death toll quite significantly? And are we taking the right steps now to prevent this from happening again?
Yes, I think that there is a very clear lesson, and I've heard the experts say it again this time, that there's really a very simple bottom line, which is that the cost of a pandemic, and you can measure that cost in whatever way you like, goes up with the number of cases. So essentially, your goal should always be to keep the number of cases down. And in order to do that, you need a kind of cluster of measures that work together. You can't just do part of them or another part of them. You need them all in place to work together to contain the disease. And I think, if we can bear that in mind, if we can think that it's a sort of all or nothing, it's a holistic, coherent approach, then we'll come out of this as lightly as is possible.
And Laura, why was the 1918 flu called the Spanish flu? And were the Spaniards equally offended as the Chinese are today that the US labelled it the Chinese flu?
That's a great and a very important question, because there was nothing Spanish about that pandemic. I mean, there are many things we don't know about it, but we do know it didn't start in Spain. We know, for example, that it was already in the States, it was already in Britain, where I come from, it was already in France, where I live, before it was in Spain. So that's a certainty. Where it did start, we're not so sure about. So there are 3 leading theories that correspond to origins in the US, in China, and in France at a British military camp.
I have always wondered how the Spanish have felt about that. Speaking of theories, have there been a lot of conspiracy theories that you've heard of that we can kind of compare to 1918?
Yeah, hoaxes, conspiracy theories, fake news is a perennial feature of pandemics, as is xenophobia. One of them there was less understanding of the disease then too than we have today, I think. So perhaps it was more fertile ground. But people thought that noxious airs were floating off the battlefields of Flanders and drifting over the world and causing this disease.
And just finally, Laura, you talked about the other pandemics in the past that we can also learn lessons from. What can we learn from them?
I think we can learn that pandemics happen, that we cannot yet, with the state of our science, prevent them from happening, but we can't predict when they'll happen or how bad they'll be. And so the only kind of option left to us is to prepare and make ourselves pandemic proof to as great an extent as possible. And that means, investing in our healthcare, investing in better disease surveillance, and doing all the things the WHO has been telling us to do for a very long time.
Laura, great to talk. Fascinating insights. Really appreciate your time. Thank you.
Thank you.